Hi, I'm Annmarie Seldon with the National Library of Patient Rights and Advocacy, and my guest today is Michele Nadeem-Baker. She is co-founder of Kicking Cancer in Heels, a global communications consultant, a patient reporter with Patient Power, a reporter for OBR Oncology, and The Patient Story, and works on special projects for WebMD. She's very passionate about helping those who are dealing with cancer as well as at patient advocacy. So welcome.
Thank you so much for having me today, Anne-Marie. It's a pleasure to be here with you.
Tell us a little bit about your background in patient advocacy.
Well, when I started out, and I did not realize I was being a patient advocate, truth be told. I had started out doing the communications and PR for Patient Power, which is now part of Health Central. And I was starting treatment for my leukemia. And the founder also had a broadcast journalism, a TV news background. And we discussed it, and I had wanted to get back to reporting, to report from the front lines, to demystify what it was like to have chemotherapy. And this is back before that became popular with social media. So this is back in 2015. Times have really changed in not so long of a time. So I started reporting my first day in treatment on chemotherapy live from the chemotherapy chair. And I haven't stopped since. And then I realized someone told me it was patient advocacy, and I didn't even realize it. And that's just continued to grow.
That's great. And so tell us a little bit about what your current patient advocacy roles are. We mentioned Kicking Cancer in Heels.
Yeah, I like to say that I'm more than a patient advocate because my background, very similarly to yours, is both professionally in broadcasting, in TV news, as well as with corporations in charge of their communications. So I've been told by some people in pharma that I'm a unicorn, and that would make you one as well, and that we can see the entire picture. So we can see how more is needed for patients with patient engagement by pharma and healthcare providers, as well as patients really need to be in front of them more and speaking as to what it is, what our needs are, and how it can be helped. And I have seen that start to change out there. It's more than just lip service that's being paid to patients. And that makes me very happy. But in addition to that, I do continue with my reporting, as well as I also am working with different companies on patient engagement strategies and being able to speak to patients and connecting everyone together so that we can bridge that gap in communications that has existed for as long as medicine has been out there.
Yeah, I feel like communication is so important. And I think it's hard for certain people to advocate for themselves. How hard, when you're first diagnosed with any rare disease or any cancer, to advocate for yourself?
First of all, it's hard even thinking that you have something that's happening to you. It's shocking, and to get used to the idea of that. But for me, the day I was diagnosed, it came out of left field. I had no clue anything was wrong with me. I was the chief communications officer globally for Royal Caribbean Cruises and all of their different cruise brands, including Celebrity, over 66,000 employees around the world. Anything that came out that was spoken, it came under my department. Anything that was out there for ship launches, for crisis communications, all of that came under me. And here I have a doctor telling me, thinking in a few minutes he can walk into the examination room and tell me I have the C word when I have no clue what's even wrong with me. And I honestly didn't know what he meant by the C word. And that just shocked me. And then he blurted out the type of leukemia I have. And all I knew was he said the word leukemia, and there were two words before it. And I have something called chronic lymphocytic leukemia. And then he said, okay, I'll see you in 4 months. And I had to stop him and ask him, what do we do? Let's get rid of this now. And he said, oh, no, that's not how it works. You'll be fine. And so I asked for something. Do you have any information? No. Do you have a printout for me? No. Does the hospital have a site, an intranet I can look at explaining this? No. can you tell me about somewhere I can go to find information? It was all no. And I'm like thinking, I communicate. How can there be nothing out there that has to do with communications to explain to me what's wrong with me? And I was totally dismissed by him. So I knew when I walked out of that hospital, and this is in Miami, that I would never go back there because it was extremely poor. I had no clue what was wrong with me. I thought I was dying and that I wasn't going to be treated. And inside, I knew that someday I needed to help change this for patients, that this was unacceptable. But I had to deal with what was wrong with me. I didn't understand it. And that just shouldn't be the way things are.
You're right. And I think it varies from primary care physician, general practitioner to actual
This was an
specialist.
oncologist, and
Yeah,
this was a
specialist.
hematologist oncologist. So shame on him.
Yeah, yeah, yeah. And I'm sure it is a frightening time for anyone, and that communication and information is so important.
It's a life-changing diagnosis, any diagnosis like this. So luckily, the next month, I immediately got an appointment at a wonderful cancer center where I've remained, Dana-Farber Cancer Institute in Boston. I left Florida. I left, everything that was down there and came back to Boston. It's where I'm from originally. And I was living between the two places. My family was up here. It was the right thing to do. And here's the but, I didn't need treatment immediately. But had that been explained to me properly, then, who knows?
Yeah. Right. So what's the most important thing you wish someone told you before you embarked on your own cancer journey in terms of, meeting with doctors, maybe digging information for yourself?
The most important thing would be to not think Google is a doctor.
Very good point.
I hear from so many patients now, and I did this. I didn't know what to do about what this was. I knew there were 3 initials. I was guessing at them. I thought the first word might be chronic. Wasn't sure though. Last word was leukemia. And I had written on a piece of paper when I got in my car after that dreaded appointment, CLL, CCL. I wasn't sure what it was. And then I found chronic lymphocytic leukemia. And at that time, I did not know that there are, there's old information on the web. There are sites that are not reputable, that are not credible. And I should have known that having been in news, but this was a whole new area for me because I had never, thankfully, had anything wrong with me at that time up until then. So I was seeing that I'd be dead in 3 to 5 years. I also saw crazy things like if you had any root canals, to have them all pulled out, to get an infrared sauna in your home and you'd be cured. There was quackery out there as well as outdated information. So my advice would be, first, stay off of Google. Just stay off of Google. If you can, sit on your hands. And if you absolutely have to go, look at places that are credible, like a large cancer institute, but very current information.
Yeah,
nothing is outdated. Yeah, check on the date because, the great thing is medicine research works at light speed, it seems. Because when I was from the day I was diagnosed to today, there are so many new treatments out there. And when I was diagnosed, there really wouldn't have been much for me, except one thing, which would not have worked that well.
And you're right, within the blood cancer area, 20 years ago was a different story.
Absolutely. And I was diagnosed in 2012. So that's 12 years now. And things have changed drastically in that short time. So I am happy about research being that way. So I would say, in addition to not going on Dr. Google or, try to find quickly which sites to go to. Now, one way you can find that out is looking for online support groups. So within particular cancers, they exist, but you have to look at them and feel them out. And I'm sorry to deliver that, but some of them, again, aren't necessarily credible, or they don't necessarily monitor what other people are saying. So with Kicking Cancer in Heels, that's for people with any kind of cancer. But if we see things that are being posted that aren't accurate, We will comment on that or take them down, but within specific cancers, like for chronic lymphocytic leukemia, I'm also the co-head of something called CLL support group on Facebook. And that is the largest social media platform for patients with CLL. So, you have to feel your way around. And as far as credible sites, that you need to find, but I would say the other thing, so that's number 2 would be join a support group. Number 1 is Google's not a doctor. Number 3 would be get yourself an appointment with a specialist in the type of cancer you have. I lucked out on that. I had never heard of what I have. Never mind, no, it's a whole specialty within not only oncology, but hematology oncology. So find a specialist. If they don't live near you, see if there's some kind of second opinion program where you can do something virtually, because your first opinion was being diagnosed. This could be your second opinion.
Very great information that was getting to that, because as patients, what can we do on a daily basis to continue to advocate for ourselves? Not only communication with your doctor, maybe doing support groups, but mental and physical. What can we be doing on a regular basis?
So mentally and physically, it's hard mentally in the beginning, emotionally. And you know what? It's okay if you're feeling like there's just not something right here. It's, I'm going to give people permission to feel that way, because it would be pretty abnormal if you didn't feel anything, right? If you're diagnosed with a life-changing cancer or another type of chronic disease. But different cancer centers and doctors ask them, if you're feeling a lot emotionally, talk to your doctor about it, and maybe see someone you can talk to about it. But support groups also help in that respect when you're feeling that way. But it is very important to eat healthy and to also exercise. I exercised even in the worst of treatments when I was having chemotherapy for a week, a month. Aside from those days, I would go to the gym. And for me, not only was it keeping my body stronger, but emotionally and mentally, it made me feel like I had control over something in my body that had betrayed me.
Right.
And working out was my way to try to control some of what was happening to my body in a good way.
All very good points. I mean, you seem like a very positive person, and so that I think helps too.
Yeah, you have to be even on your darkest days, and it's not easy at all.
Well, thank you, Michele. Thank you for taking the time. All good points. I really appreciate it.
Well, thank you for having me. And if anyone is interested, I'd appreciate it if you wanted to follow our group, our community, Kicking Cancer in Heels. We're on social media, and also we have a website.
Great. Thanks so much. I'm Annmarie Seldon, and we'll see you next time.